portfolio program really is used as an icing on the cake, or an incentive, if you will, for providers, physicians who are participating in our quality improvement program.
And the fact that we can do something to decrease the work and save time and still qualify for MOC Part 4 was pivotal.
This program can be implemented in a multitude of different ways and have it work for you.
We know that it's important for the diplomat to choose what they want to work on.
Both of our portfolio programs sound like an organized, common sense format to guide somebody through the process.
Personalizing it and embracing that the diplomat knows what's meaningful for them and what would help them and their patients, as well as save time, is the approach that we took.
You really truly can tailor it and implement it in your program in such a way that it meets the needs of your organization and the people that you serve.